Hello student, today we are going to learn about diabetes mellitus. Definition of diabetes mellitus. Diabetes mellitus is an inherited or an acquired chronic disease which is either caused due to the production of insulin in insufficient amount or due to the inefficiency of insulin produced. As a result of deficient amount of insulin, glucose concentration in the blood increases, thus damaging several organs of the body, more specifically the nerves and blood vessels. It is the most common form and is mostly referred to as diabetes. Moving ahead, we will see the types of diabetes mellitus. Diabetes mellitus can be classified based on the clinical stages, and the etiological types are as follows. According to the clinical stages, first, insulin requiring for survival. This corresponds to the former clinical class of insulin dependent diabetes mellitus. Second, insulin requiring for control. This class is characterized by the requirement of insulin for metabolic control rather than for survival. 3. Non-insulin requiring. This class includes those diabetic patients in whom diabetes can be controlled satisfactorily using non-pharmacological methods or drugs without use of insulin. Now, according to etiology, type 1 diabetes mellitus. This type is characterized by destruction of beta cells, that is insulin producing cells, and thus insulin is required for survival. This type was referred to as insulin dependent diabetes, though the term is obsolete now, and can be further classified into two types. Type 1 immune mediated diabetes mellitus. In this type, autoimmune destruction of beta cells occurs. Other terms for this type of diabetes mellitus are insulin dependent diabetes or juvenile onset diabetes, since it may begin during childhood. Second type, type 1 idiopathic diabetes mellitus. This type is not related to autoimmunity and the beta cell destruction is due to unknown causes. Type 2 diabetes mellitus. This type is characterized by disorders of insulin action and secretion. Patients have relative insulin deficiency in contrast to obsolete insulin deficiency in type 1 diabetes. It is also known as adult onset diabetes and was earlier referred to as non-insulin dependent diabetes, though the term is obsolete now. Type 3, that is other types. This includes those in which the underlying defects or disease process can be identified in a relatively specific manner, for example, fibrocalculous pancreatopathy. Thank you.